Hello friends, so today I am here again with you to discuss a paper which was published in Indian Journal of Orthopedics in 2020, and the topic was falls in elderlies. So this paper was a landmark paper because it told us many important things. So I'm going to briefly tell you about the gist of the paper. Patients aged more than 80 or 90 years had 50% chances of having multiple falls each year. There are three important factors which causes such falls: extrinsic, intrinsic, and exterior causes. So intrinsic causes could be either due to decline in the physical health or cognition levels. Extrinsic factors to poor lighting, slippery floors, poor footwear or obstacles in their houses. And the other is situational, that is activity related. The patient may be distracted because of the phone they have in their hand, or due to rushing off in the bathroom at night time. So these are the most important causes of fall. The other important causes of fractures is when these people even have a trivial fall, they have fractures because of important thing, osteoporosis. So it is very important to evaluate such patients. The gist of the paper was that in order to get these patients back to normal, it is better to prevent such falls. So to prevent such falls, avoiding poor lighting, getting the patient back on a non-slippery floor, having adequate footwear. Intrinsic factors, that is physical factors, we have to take care of the patient's muscle mass by giving them adequate nutrition, working on their muscle mass and also endurance. And then situational factors, the patient should be educated not to use phones or do multiple things at the same time and avoid rushing. It is estimated that by 2050, India will have the maximum number of elderly patients, that is 20% of the population. So it is very, very important to have this paper in mind and work towards it, because the health of our population is in our hands. Thank you.